And now, where does one begin when newly diagnosed with cancer? And what cancer care advancements can help on this journey? Well, let's head out on location and talk with a radiation oncologist, a care coordinator, and a patient to discuss new, innovative healing care options for cancer patients. We're here talking with Dr. Forker about oncology and specifically radiation oncology and what are some of the trends and some of the cancers that we're seeing more of. So first of all, Dr. Forker, thanks for being with me.
Of course, yeah.
So we're talking about oncology. This is what you do for a living in terms of radiation oncology. What kinds of cancers are really prevalent that you're seeing right now?
So we treat a lot of different cancers within radiation oncology, but some of the ones we see most of are prostate cancer, breast cancer, lung cancer, head and neck cancer, colorectal cancer. Again, other less common cancers as well, but that would make up typically our most common cancers that we treat.
So when a patient is diagnosed with cancer, what is their kind of first plan of action? I know recently I've had a friend diagnosed. What is it that we say to her in terms of how do I develop this plan of action on this journey that I'm about to embark upon?
Oftentimes, if it's a screening test or there's been some initial symptoms, patients may start with their primary care physician that's kind of ordering some of the initial tests. Most typically then they would be seen by a medical oncologist, who's a doctor who specializes more in the delivery of chemotherapy. And then that patient will usually be routed to other specialists based on what they would need for their specific cancer and the stage of their cancer.
This full spectrum of services here at ProMedica Flower and the Cancer Center here is really, really wonderful for patients. So thank you.
Oh yes, I mean it's definitely part of, we look at it all together as part of the care of the patient, and so I think patients feel that extra degree of comfort to know that it's not always just about the medicine and what's going to be delivered to them, but also about just the patient as a whole and taking care of them that way.
Yes, thanks so much for being with us today, Doctor.
No problem. Good talking to you.
I'm here with Deborah Reese, and she is in charge of the Healing Care Center here at ProMedica Flower Cancer Center. And we're really talking about a program, Deborah, thanks for being here.
Thank you.
A program that is really helping those who've been diagnosed with cancer.
Yes.
And how they can really navigate a journey and a pathway for themselves. So give us an overview, if you would, about this Healing Care program that you are responsible for.
Yes. The Healing Care program is a complementary therapy program for our patients who are going through treatment, but it's also good for their support people as well. And it really is to help a person cope through the cancer journey, through that experience. So really looking, and that can be very different for each person. Same diagnosis, but really handling it in a different way. So really looking at what is that person going through and how can we help complement the plan of care that we are doing here at the Cancer Institute.
So once a diagnosis is made, how is it that they can step into this program? How are they referred to it? And how do they get involved in the program?
They can get that referral from anybody. They can even refer themselves. So if they see the information, they're like, I want to do something like that, they can actually refer themselves, and that is perfectly fine.
Give our viewers an understanding, and our listeners as well, as to some of the very specific offerings that you provide for patients who have cancer.
Yes, yes. So we do provide therapies under the relaxation stress management umbrella, let's say. So that might be breath work. So really helping a person cope with maybe if they're claustrophobic and how we can help them breathe and be in control. It might be imagery or healing touch, which is an energy therapy that we might do. And then we can integrate aromatherapy, we can integrate the ear seed therapy. Those are all modalities that we provide under the Healing Care program.
Let's go talk to a patient.
All right, thank you.
Here we are in a healing care room for the patients, and we are going to be talking more with Jenny Whitfield, a patient who has been receiving wonderful care following her cancer diagnosis. Jenny, thanks for being with us today.
Oh, my pleasure.
We appreciate your input and wanted to hear a little bit more about your journey here and what brought you here.
Last year I was diagnosed with breast cancer, and I was starting to feel really depressed and wanted to kind of give up. And then Deborah came into my life.
I'm glad that you're here with Deborah, and I know, Deborah, you've been really helpful in her care plan as she was diagnosed with cancer. And so tell us a little more, if you would, about the seeds that Jenny has had.
So as Jenny mentioned, the seeds are what we call the ear seed therapy, and they are tiny seeds that we put on the outside of the ear, and they actually are on pressure points that correlate with areas of the body. Jenny has asked for the digestive protocol, something to maybe help her with the nausea during this treatment time. So this is we're going to do 5 points or 5 seeds on each ear, so a total of 10. So you can see that these seeds are, they're like a hard seed, and they're like a Band-Aid. They just peel right off. So first I'm going to start with cleaning the ears with an alcohol wipe. Okay, very good. And we just kind of let that dry for a moment. So as we begin, I'm going to do a seed that's going to be here on the top of that ear, what we call the Shenman, or it's a relaxation point. So just about everybody who's getting ear seed therapy will get this point. This next seed is going to go in the fold of the ear, and that correlates with the intestine. Then I'm going to put 2 points right on the ear, and that correlates with the stomach. And then this is going right on a point that correlates with her stomach. And then this last one, number 5, is going on a point right next to the opening of the ear that correlates with the endocrine system, which is about hormones and things of that nature. So that's another point that we are putting that.
And Jenny, you said you really, really appreciate what these are doing for you.
Oh, absolutely. Absolutely.
And then also, Deb, you are really active in offering aromatherapies.
Yeah, for the aromatherapy, yes, and all of the tools that we provide, have evidence behind them. So we are using the aromas that are really going to be helpful. They're not going to be contraindicated to her medications or anything she might be doing as far as her treatment plan. So it's really meant to complement or enhance her treatment plan.
So tell us more about how that lends to healing, especially with you, Jenny, and how you've been able to really spend time in this room. And
she teaches me techniques that I could take home with me. She has introduced me to the oils, which I have at my house now. She has made up an inhaler for me to where when I start feeling sick or nausea, I just take that all in and it's like gone.
Well, thank you very much for being here with us and for sharing your story.
Thank you, Jen.